So with all of this incredibly detailed work, all these layers, what does it mean for the industry and maybe for listeners trying to grasp the big picture? Are there global rules that pull all this together?
That's a really important question because, yes, this isn't just up to individual companies. There's a strong regulatory landscape underpinning all of this. It ensures a kind of universal standard of safety. You have international biosafety guidelines. The World Health Organization, the WHO, provides comprehensive guidance, risk assessment, facility design, safe practices, widely adopted. Then, nationally, take the U.S., for example, the Centers for Disease Control, CDC, has the biosafety level classifications, BSL-1 through BSL-4.
Right, based on risk.
Exactly. Higher risk agent, much stricter containment rules. BSL-4 is for the really dangerous stuff. And the National Institutes of Health, NIH, has specific guidelines too, especially for things like recombinant DNA research, genetic engineering, frameworks for doing that safely.
Okay, those are guidelines. Are there actual enforced standards too?
Oh, yes. Industry standards are critical. Think ISO standards, the International Organization for Standardization. They have standards for quality management, like ISO 9001, that apply. For pharmaceuticals, good manufacturing practices, GMP, are legally enforced by agencies like the FDA in the US or EMA in Europe. They cover everything about production to ensure product quality and safety. Containment is a huge part of GMP.
Okay.
And then you have worker safety regulations, like OSHA in the U.S., Occupational Safety and Health Administration. They mandate safe workplaces, training, PPE use, specifically protecting the people doing the work in these labs. What's really, I think, quite fascinating is how all these guidelines and standards, they sort of create a common language for safety around the world. It helps ensure that wherever this kind of work happens, there's a fundamental commitment to protecting people, protecting the environment,
Right.
which actually brings up an interesting point for the future. How do we see that balance evolving between having these really necessary, sometimes strict regulations and also wanting to encourage rapid innovation in biotechnology? It's a dynamic tension.
Wow, yes, that's a great question to ponder. This whole discussion has been just an incredible deep dive into a world that, most of us never see, but it's so fundamentally vital. From the tiniest seal on a vessel all the way up to global regulations, the commitment to safety is just profound. Our deepest thanks go to technologist Dr. Rama Yusvana. He's a senior lecturer from the Faculty of Engineering Technology at Tun Hussein on University of Malaysia, UTHM. Thank you so much for sharing your expertise and giving us such invaluable insights into this really critical world of containment.
My pleasure entirely. Glad to discuss it.
So, as you are a listener, think about the medicines you might take, or maybe bio-based products used. Just take a moment. Consider those invisible layers of safety, of containment that are constantly at work, always evolving, always improving to make our world safer. It really makes you wonder, doesn't it? How much more innovation can we unlock as these safety systems become even more sophisticated, even more seamlessly built in? Something to think about. Until next time on The Deep Dive, stay curious.